am Christos Papanikolaou, and we are today at Opto TV new web episode. Opto TV web channel is the first web channel dedicated to ophthalmology and optometry in Southeast Europe. Today we have the pleasure and the honor to have as a guest Dr. Balidis, Scientific Advisor of Ophthalmica Institute, former President of the Greek Association for Refractive Surgery and Intraocular Lenses, and the only Greek candidate for ESCRS Director of Boards. Dr. Balidis, it is a pleasure having you today here.
Thank you very much for the invitation. It is a pleasure to be in your web channel.
Let's start direct with the first question. I want to ask you regarding the diagnostics, the new diagnostics in the anterior segment. What do you think are the most important advancements of OCT technology in the anterior segment? Do you still use the more traditional Scheimpflug tomography?
Scheimpflug tomography was very useful, reliable, and reproducible. It was a great tool for assessing cornea and anterior segment. One important problem, though, was the acquisition time and the influence of eye movement. Also, scars and opacities in stroma may affect the final result of the scar. That is why OCT technology has a shorter acquisition time, so eye movement is negligible. Also, all the opacities that you have in the stroma can be very easily detected in the OCT without having any alteration of the final result in the scan. These are very important reasons so you can assess the clarity of the corneal stroma and also have more reproducible and more reliable scans.
So the discussion is coming now. Did the anterior imaging diagnostics improve with anterior OCT in your practice? And if yes, in what aspect?
Yes, anterior OCT has been implemented in our practice, especially for assessing keratoconic patients, examining them, assessing the refractive candidates for ICL or even for laser refractive procedures. Additionally, we can even use them for unrevealing views that are difficult to find in the beginning, like iris cyst, IOL dislocation, and severe traumas. So all these can give you a fantastic examination and a view that you can never have with any other instrument, changing your management and also your planning of your surgical approach.
So, Dr. Balidis, previously you have mentioned keratoconic patients. Do we have any recent advances in this management of those occasionally demanding cases?
Keratoconus is a disease with a huge variety of expression which demands different approaches and different procedures. As I can say, it's fully personalized in each case. So now we have a very important advancement, which is corneal cross-linking. The collagen cross-linking of the stroma is a major advantage, and now we also have customized cross-linking approaches where we can actually focus on different areas of the stroma of the cornea. We have customized irradiation powers. We have different lasers that we may use in the future, again, for the cross-linking of the stroma of the cornea. One other important aspect is that we have new laser platforms, new diagnostics, and we have a more advanced way to ablate corneal stroma with our excimer lasers. This is another important aspect. The third thing is we have the opportunity of intrastromal surgery. In the beginning, we have added rings which were usually PMMA made, but now we have different biomaterials, 3 new biomaterials, which you can add in the corneal stroma and have a dramatic effect in corneal curvature and also strengthening corneal stroma. I believe these are great advantages that we have to use and we have to implement in our armamentarium for the future of the keratoconic patients.
Dr. Balidis, being also a refractive surgeon, what do you think is going to be the future of refractive surgery? What should we expect for the years that is going to come?
I think it's going to be a very big change. It already happened in the beginning with the refractive intrastromal surgery, what we know as SMILE. Of course, SMILE in the beginning has some drawbacks. The major for me was that there was only one platform that has available this procedure. Having in the years to come, refining the energy of the lasers, having better ablations, I think SMILE is becoming into the new era. More platforms are coming, more laser treatments, better quality and better energy of the laser treatments. All these are going to have a huge increase in the numbers of SMILE worldwide. Apart from that, we still have the traditional LASIK and PRK, because don't forget that we have some very demanding cases that we have to be treated with topography-guided ablations. Also very difficult cases that we have abnormalities and aberrations that cannot be treated with SMILE. So PRK and LASIK are still very important for refractive surgery. And in the future, we're expecting more options for presbyopic treatment, either in the form of phakic IOLs or IOLs implanted after clear lens extraction.
And now I'm going to ask you something that is really important for people at my age, with 45 years old. The question is coming to presbyopia correcting IOLs. That is my next question. Do you think that we have reached a stage that we can offer in our presbyopic population a solution which is going to be viable for the years to come?
Thank you for your question, and it's a very nice one and very important. I think we still have a challenging moments on treating presbyopic patients. That's why we call it the Holy Grail in refractive surgery. Now we have to address first if there is another ocular comorbidity like cataract, hyperopia, astigmatism. We have a chance of excellent correction with our trifocal lenses, both for distance, middle distance, and near vision. But what happened with the visual disturbances? We still have visual disturbances with our multifocal lenses. That's why we have the new EDOF, enhanced depth of focus lenses, where the visual disturbances at night are minimal. And we can have a very reliable distance, middle, and even near correction. And I believe in the future, EDOF will even have a better near correction than its existing one. We also have new versions, new generations of accommodating IOLs, and we have the light adjustable lenses where I believe that they have a great future. Adding on that the presbyopic laser vision correction, I think we have a palette of a lot of interesting options in armamentarium to clear presbyopic, hyperopic, myopic, and astigmatic correction at the same time. So the future is still away, but it's not that far away.
Dr. Balidis, thank you a lot for this so interesting interview together, but I want to ask one more thing. I have to point exactly in your candidation for the ESCRS Board of Directors, and I want really to know what is your vision for the ESCRS in general.
ESCRS is already a very successful organization. And I think I can add only two things, two important aspects that we can make it even greater, even better. One aspect is the young ophthalmologist, and improve, at least to a certain extent, the well-trained young ophthalmologist. They have already started planning towards this direction, and I think we can even make it stronger. Surgical training still needs a lot of support, especially in refractive surgery, but also in cataract. The second aspect is that ESCRS was, is, and it will be the best congress for refractive surgery and cataract surgery in the world. Think about it. All the new technology, that is a congress that you're going to meet with most important people, excellent surgeons, and fantastic teachers. So why to keep it European? We have to make it something which is going to rule worldwide. We have to bring more and more people to our Congress to make it bigger, stronger, to make it the best Congress in the world. Because Europe, don't forget, is where is the center of the world for me.
It is true that Greece has a great tradition in refractive surgery and cataract surgery, and a lot of Greek surgeons are very well known and famous around the world. We cannot forget that the father of LASIK, Professor Palikaris, is one of them who started a new era in ophthalmology. It was an episode of Opto TV, and we had as guest Dr. Balidis, who have talked with us very interesting points about corneal refractive surgery and the future in keratoconus and IOLs. Dr. Balidis, I thank you a lot for your presence to our Opto TV episode. I hope we meet us soon, and we make another interview very soon also. And I want to wish you very good luck for the elections of ESCRS.
Thank you very much for the invitation. It was a pleasure and an honor to be here, and as you know, I always be whenever you want me. Thank you.
Thank you one more time for watching us. Stay tuned. See you soon.